Hi, again, we have another theory called experiential learning cycle. This is very good theory, very easy, straightforward theory. And this is a tool that we can use to reflect on our experience so that we can get better. This is again a cyclical one, meaning you do it again, you do it the day after, next year, year after, and so on. So because there's nothing as best practice today, there's nothing as expert in anything today. You may be a better expert or more expert than tomorrow on the following day, because things are getting better on a daily basis. So we need to apply this theory to reflect on our experience to get better on and on, continuously over and over. Okay, so what is this theory about? This is about a four-stage cyclical theory. Four stages are there. The first one is about the concrete experience. That's the first stage. The second stage is about reflective observation. And the third stage is about abstract conceptualization. Finally, active experimentation. This is what the whole lot of theory. So let's see what concrete experience is about. If you are a doctor, you need to have experience. You have to have concrete, very strong experience on your treatments. Okay, so you should deal with enough patients. That is what the meaning of concrete. Too many or too much of experience. If you are a lecturer, you may do about 40 hours of lecturing per month, or 10 hours, 15 hours of lecturing a week, 3, 4, 5 hours of lecturing a day. If you do that, you have the concrete experience. If you are a footballer, you may practice football in your ground every single day. You may do 300, 400 kicks practicing. And you should have played at least 2 or 3 matches weekly. That is concrete experience. Okay, if you're a pilot, if you're a pilot in an aeroplane, you should have 10,000 hours of learning or flying, sky time. This is what we call the concrete experience. Okay, if you are a lawyer, you should have fought about 10,000 or 1,000 cases. If you are a lecturer, you should have learned about 10,000 hours on a particular topic. Meaning, doesn't mean that you need to learn 10,000 hours or you need to fly 10,000 hours, you need to treat 2,000 patients. No, what I mean is you should have enough considerable amount of size of experience, strong experience, too much as many as you can, as much as you can, do it. Okay, spend too many hours or as many hours as you can in experiencing things. This is concrete experience. Okay, when you have the concrete experience, strong experience, very much involved in, we know what we have done. Okay, we know what we have done. So what you do, you look at what you have done, what went good, what went bad, what could have gone in a different way. You reflect on it. Look at what you have done. Okay, you are a doctor. You cut a body to do some surgery. So the way you cut today, after the cut, you cut it yourself. You went deep in the body with your knife, with your blade. So you have the concrete experience today cutting a body. You have done it yourself. So that's what the strength, the concrete experience. Based on the cut, based on the stitches, based on the work that you have done inside the body, when you go to bed, you recall the theater's time and you realize this is what I have done. Next time, when I cut the blade, when I use the blade in a different way, I should reduce the pain. I should reduce the length of the cut. I should make the cut easy. I should make the stitches easy the way. So you reflect on it. Okay. After the reflection, you develop a new concept, new theory. Next time when I cut the body, this is how I should cut. That's a new theory for you, new concept for you. If I deliver a new speech tomorrow, based on what I have done, based on the delivery of my speech today, I develop a new theory. Tomorrow, when I deliver this, I have to do these kind of things. This is what the concept is about. The new conceptualization, new idea. That's a new theory. That's a new way of practice that you're going to do. So you have a new theory now to do the same thing. Okay, it is operation. You know the way to cut it tomorrow in a different way. If you are a pilot, then you have a new way to take off and land. When you take off, some pilots, when they take off, it's scary, it's difficult. You can't listen to the sound. And it is when some other pilots, when they take off, it's very smooth. You don't feel the flight has taken off from the ground. And you may realize this when you land. Some pilots, when they landed, they bang the flight on they hit the ground with sound. Some others, you never realize the flight is on the ground. I have experience. Right? Sometimes we talk about it. The two young guys, they took the flight, and we didn't realize they were taking off, and we did not realize they were landing. Right? You don't see any pulse of it. So if you want to make this smooth landing, what you do, previous landing, the landing that you have done before that previous landing, all the landings that you have done, learn the lesson, reflect, and make a new theory for yourself to land the flight next time. This is what the new theory. So you have a new theory now. So what you do next, you experiment it, try it out, land it in that way, applying your new theory, cut the body of a patient based on the new theory, because you have a theory already that you have developed based on the reflection. Try it out, experiment. When you experiment it, you would figure out more. When you experiment this one, you are exposed to the experience again. So that based on that experience, again, reflect, again, abstract the new concept, and cut again, experiment again, land again. This is what the theory is about. So experience, reflect on the experience, develop a new concept, experiment. The experiment will make you to experience more again, then cyclical. Okay, this is what it is. If you don't do this, if you don't improve yourself, you are not learning anything from your experience. Now, the point is this: experience alone is not enough. Okay, you have done 25,000 hours of flight, 25,000 cuts or operations in the operations theater. That is your experience. That's fine. Experience is not useful to you unless you learn from the experience, unless you reflect from the experience. If you do the same cut, same landing, same takeoff, no, you should have improvement in it. This is where we talk about the learning. So experience is not enough alone. It's not alone enough at all. What you do based on the experience, you have to correct yourself, right? Let's say people steal you, people rob you. Okay, so you have an experience. Now, if the same person steal you for the second time, did you learn anything from your experience? No. People cheat you. When they cheat you for the first time, okay, you learn from that experience. Next time, the same person or some other person cheat you the same way. Did you learn anything? Have you experienced anything? Is it useful to you? Not at all. The experience that you have today should secure you, should give you some defense if the same thing comes up in your way. It should give you some better options. It should give you some better curing to you if that comes up next time. This is what learning is about. So experience plus learning beneficial. Experience alone, no. Okay, so experiential learning, experience and learn from that. And it is cyclical. Once experienced and learned once not enough, it is forever, continuously learn. This is what this Kolbs experiential learning cycle is. In short, I would say, can learn a lot. Okay, so I think that is it from this theory.